It's time to have a conversation about adult ADHD. Symptoms often appear in childhood, but just because you weren't diagnosed as a kid doesn't mean you don't have it. Theresa Cerulli, a board-certified psychiatrist and ADHD specialist, joins us now with some advice on managing the condition. We're excited to have you here, doctor. So what does ADHD look like in adults?
Thanks so much for inviting me to talk about this important subject. ADHD in adults presents with the same three core features that we see in childhood, and that's inattention, hyperactivity, and impulsivity. But with adults, the hyperactive impulsive symptoms tend to become more subtle over time, which is why we used to think kids grew out of this condition. What persists into adulthood, mostly, many folks have I'll put the emphasis on the inattentive symptoms of ADHD. So the difficulty paying attention to details, making careless errors, difficulty with organizing oneself, with time management, with forgetfulness, trouble remembering details on a schedule. Those are the symptoms that many adults with ADHD still struggle with at a significant level, whereas the hyperactive impulsive symptoms become a bit more subtle in adulthood.
Well, then how serious are the consequences of living, with ADHD undiagnosed?
Let me start with some statistics here. So in the US, 4.4% of adults with ADHD have ADHD, and that translates to about 10 million adults. And so unrecognized, which unfortunately is still about 75% of those 10 million adults with ADHD don't know they have ADHD. So the importance is, I want to emphasize, we do need to do a better job clinically, both recognizing and diagnosing the condition, because undiagnosed ADHD actually has some real challenges associated with it. Careless errors isn't just about the kid struggling in school to get good grades or behavioral problems. Think of day-to-day life if you're struggling with attention to detail. I'm going to give you an example that I learned from my patients, sharing examples hopefully we all can learn from my patients. The adult male patient that I'm referring to was forgetful in dropping his son off at daycare. His son had fallen asleep in the car seat in the back of his car, and this adult was on his way to work, forgot to drop the child at daycare because the child was sleeping and quiet. So went about his business. The good news is the end of the story works out just fine, but those are the details that sometimes can be quite serious when untreated.
Yeah, that's scary. So why do you think then adults are either being underdiagnosed or undertreated here in America?
I think in part because of what we just talked about and the way adult ADHD presents is that if it's mostly inattentive symptoms, those aren't visible to someone else, they're internal, and everybody at times struggles with attention. So it's hard for people to know, A, that their struggle is different than anyone else's, and it's very tough for clinicians to recognize that a lot of these folks present with other challenges and no one's seeing what the root of the problem was. In other words, people might come in feeling more sad or more frustrated or have problems in their relationships or struggling to get that promotion at work or even to maintain their position at work. And no one's thinking what might be at the root cause of that.
Right. Okay, well then let's talk about treatment options.
Yeah, let's think multi-pronged approach. Research has shown both a combination of medication and non-medication approaches is what works best for treating ADHD. And so non-medication approaches might be ADD coaching, therapy, family therapy, school supports if it's a child with ADHD. And the medications, we have two categories, stimulants and non-stimulant treatments. Most of our listeners today are probably more familiar with stimulants. They've been around for many years. But the non-stimulants, I want to say we have had recently approved by the FDA a new non-stimulant medication called Qelbree. It's the first non-stimulant in the last 20 years approved for treating adult ADHD. So this is good news in the field. We really haven't had many non-stimulant, non-controlled options in adults. Prior to this, there was only one.
Wow. Okay, well then where can we learn more?
So the medication I just mentioned is Qelbree, and so you go to Qelbree.com. That's Qelbree. I'm spelling it because everybody wants to put a U in that word after the Q, and there isn't one. So Qelbree.com. And for learning more about adult ADHD, really important for us to all raise awareness. Go to the ADDA website, which is add.org. That's the Adult Attention Deficit Disorder Association.
Wonderful. Well, thank you so much for helping us get out the important information. Of course, if you'd like to see this segment again, head to our website as well, firstcoastliving.net.